what it was like to pivot to remote learning with her students. I'm sure if you read the news today, what kind of a learning environment there will be in the fall is certainly big news. So that was a very topical and informative conversation. Our second conversation last week, Linda Foster from the local NAACP chapter and Dr. Doris Houston, who is a social work professor at Illinois State and recently was named interim director of diversity and inclusion there, spoke about race and racism. Again, a very, very interesting conversation with good dialogue from the participants and the speakers. Today we have our last presentation, again, very topical. Marianne Pullin, who is with Home Sweet Home Missions, is going to talk about the effects of COVID and our economy on the homeless and the almost homeless. And then Tara Ingham from Midwest Food Bank is going to talk about how her organization is assisting folks both locally and nationally with providing food during this time of food insecurity for many folks. So again, there should be time for questions. If you think of a question, you can just put it in your chat box and we will hopefully get to it, or later you can unmute yourself and raise your hand and indicate you have a question and we'll get to you. We have found that there's been really good participation from members of the Women to Women Steering Committee in these conversations. We have from the Women to Women at Large, we have a steering committee meeting next week, at which time we will review what our the contributions have been by our members, which will dictate how much we have in the way of grants to give to local organizations this fall. And obviously the need is great for many organizations who provide services to those folks in our community. And we think that being informed about what's going on in our community is really important as we have this grant making responsibility and function. So without further ado, I'd like to ask Marianne Pullin first to talk about Home Sweet Home Missions and specifically the effects of COVID on the homeless. Thank you, Marianne.
Well, thank you. I appreciate this opportunity. I think all of you, or nearly all of you, certainly have an acquaintance with Home Sweet Home, so I won't say a whole lot about that. But Home Sweet Home Ministries has been a part of our local community here in Bloomington for 103 years and still going strong. I would say this last year has probably been one of the most challenging ones, but one of the things that we say, you know, we survived the pandemic from 1918 and the Great Depression and, you know, all of that. So, you know, we're thriving as well. I'm the CEO there. I've been there for 12 years. And I was asked to talk about housing. And the housing that I'm most familiar with here in our community are, as Beth said, those individuals who lack housing, who are in need of housing, and also those who are at risk for losing their housing. So it's been a very interesting time. One of my favorite adjectives these days is unprecedented for all of us. So some of the things that we have faced, and I will say, I know that many of you have participated in other women to women forums where we've learned about trauma and the impacts of trauma on the health and growth and development of children and adults for that matter. And at Home Sweet Home, we approach our services from a trauma-informed perspective. And so when the pandemic hit, it just heightened, you know, all of those impacts that the individuals that we serve are facing. So just like all of us, you know, we all have faced things like isolation, you know, disrupted routines, you know, having to abide by different rules and procedures, you know, those kinds of things. And so that has had an impact on the residents at Home Sweet Home as well. But what it's also done is it has resurrected a number of past traumas that they have endured. And so, some of the things, in addition to the things that I just mentioned, a lack of support. People who are homeless lack social support. If they had a great support network, they wouldn't need us. And they do need us. And so, that's been especially challenging. As I said, some of the rules that we've all had to endure, but I can think of one of the young children that we had at Home Sweet Home during this period of time. She was terrified when she saw people with face coverings on, and we all needed to wear face coverings. So it was just hard for her. And speaking of that same child, I reflect on the earlier caring conversation about education, and it was such a challenge for this child and for her mother to attend to her educational needs. We were at Home Sweet Home, we were able to provide Wi-Fi for people, and so we were able to try to link folks up with e-learning opportunities, for the children, certainly, but also it was necessary for individuals, for adults who needed to work remotely or were on a job search or were looking for different kinds of resources. And we made resources available to individuals, such as mental health resources. One of the challenges that a number of people faced was we need to connect individuals with a variety of human service organizations here locally. And as I said, since these were times that none of us were prepared for, no matter what our emergency preparedness plans had been, I don't think anyone was adequately prepared for this. So it was often difficult for people to make those contacts. They could call the number and no one would answer, or there'd be an answering service and no one would ever get back to them. Offices were closed. They couldn't go physically, to an office to apply for benefits or receive services, that kind of thing. And as I said, the impact of recurring trauma caused many people to relapse in terms of their recovery from drug or alcohol abuse, or relapse into episodes of mental illness. And that was very, very disheartening for all of us at Home Sweet Home to experience and witness, and trying to provide whatever services we could, but feeling a little bit helpless in that regard of not being able to attend to the needs, as much as we would like to. So just to kind of talk a little bit about how our staff responded, as I said, we tried to provide as much support as we could. We continued our operations. We were not, we didn't close down. We continued to have people in our shelter. Many of you know that typically when there's not a pandemic going on, we also invite people from the community to come in and have meals with us. Well, we put an end to that. We needed to stop that to try to minimize the number of people coming and going from our facility. But we did work with a number of other organizations, including Midwest Food Bank, to try to provide people with food resources. And I'm not going to steal Tara's thunder, so that's enough about that. But we did try to supplement the services that we weren't able to provide. Another thing that was really a big change for us was that we suspended volunteer activities. Again, to limit the people coming and going, and to limit the exposure, the potential exposure to people who, might have been exposed to COVID-19. And we depend on volunteer services a lot. We serve 3 meals a day, every day of the year, and we especially use our volunteers in that area. So without volunteers, we had to increase our staffing and that type of thing. But I want to get back to our clients. I don't want to just talk about our staff for sure. I want to get back to our clients and some of the things that they faced. Again, just because so many things were closed down, many people lost their jobs. We know that unemployment just skyrocketed, and so certainly for the population that we serve, unemployment was very, very high. Whether it was a temporary close down of the business where they worked, or a permanent close down. And again, just to find employment in that kind of environment was very, very difficult. And then also the parents who had children, they needed to stay home from their jobs anyway and care for their children and provide for their children's education. And kind of speaking to the children, some of the other impacts on them were just like all children throughout our country, throughout the world. Not only were they not going to school, but they weren't involved in extracurricular activities. Again, that sense of isolation that was very, very difficult for them to face. You know, some of the things that are kind of unique about the housing situation are that, you know, you might expect that our population at Home Sweet Home might have just exploded, and that did not occur. Actually, the census has been fairly low. Part of the reason for that is because there's a moratorium on evictions. And so the moratorium is expected to expire the end of July. And so if that is not extended, I think we could see an influx in people who are homeless. But you know, for now, so there have been some safety nets that have been put in place by a variety of different entities that have helped people. So some of those have been the moratorium on evictions, the additional supplements to unemployment insurance. Those have been helpful to individuals and families. And there's a whole lot going on in our community. You know, certainly, even without the pandemic, Home Sweet Home works collaboratively with a number of different community resources. And that's especially true now. There's the Community Care Fund for McLean County that is administered through United Way of McLean County. And it is addressing needs for what they call ALICE, A-L-I-C-E, which is Asset Limited Income Constrained Employed Households. And there are about 12,000 of those households in McLean County. And so they have been able to get some assistance through that funding. Then there's the Illinois COVID Response Fund, and that's been helpful as well.
Pick up our groceries at 11. No.
In the area of just services to people who are homeless or at risk of being homeless, PATH is the coordinating agency for those services. And so, but again, it was very difficult, you know, and challenging for them to gear up to the times that we were facing. Again, they, you know, I think their volunteers probably were trying to work remotely, their staff were trying to work remotely, and the need for their services escalated. And so just to try to keep up with that, I think was very, very difficult. But they've been hanging in there. And just to let you know, one of the newest resources for individuals is an alternate housing coalition. And it's been convened by the McLean County Health Department. And actually, this is something that we recognized a need for at Home Sweet Home, and I'm sure others have as well. But we have been kind of holding our breath, hoping and praying that no one at Home Sweet Home will get COVID-19. But if somebody does, obviously they need to be quarantined, they need to be isolated, and they don't have a place to do that. And so this coalition is looking at how to respond to that particular need. You know, sometimes I say, you know, we're all supposed to shelter in place and stay at home. Well, if you don't have a place to shelter, if you don't have a home where to stay, then you need some other resources. And so that's, you know, that's where Home Sweet Home and other organizations similar to ours come in. So that's just a little bit of an overview of, you know, some of the things that we've been doing surrounding people who are homeless and at risk of being homeless. And I'll send it back to Beth. Thanks.
Thanks, Marianne. And I think what we'll do is let Tara do her presentation, and then we'll open it for questions for both Marianne and Tara. So as I mentioned earlier, Tara is with Midwest Food Bank, and she, I think, will share with us a little bit about what Midwest Food Bank does. I've been fortunate enough to volunteer once or twice there, and it's an impressive operation. And they're helping not just locally, but very much nationally. I don't know internationally, I think maybe even internationally. So Tara, if you could tell us a little bit about Midwest Food Bank and how you've been addressing the COVID challenge.
Sure. Thank you, Beth. Thanks for having me on today. I'm going to go ahead and share my screen here and get this rolling. I don't want to do death by PowerPoint, but there's some interesting data here that I think will be very helpful for us to kind of go through today. I just want to share first and foremost what the mission of Midwest Food Bank is. We're all about being a faith-based organization, that we share the love of Christ with all that we do by alleviating hunger, malnutrition, and all throughout the world and locally, and providing disaster relief. But this is all without discrimination. So I want to share with you even more about our mission and exactly what we're doing in the community, nationwide and worldwide, here in just a moment. But I think it's really important to discuss a little bit more about food insecurity and what does that look like in our local area? What does that look like across the country? And how has COVID affected that situation? So I'm going to start just by asking, what's for dinner? I'm a wife, I'm a mom. I don't know about you. Did anybody else already have plans for dinner tonight? You got something in the crock pot or something in the fridge pulled and ready to go? You know, most of us probably do maybe have an inkling or at least know what groceries we have available or what restaurants we may want to visit for dinner. But I want to make sure that we're all very well aware that 1 in every 8 households in the United States is suffering with food insecurity. That means that the next meal may not be thought of yet. It may not be acquirable, and there's some stress or some worry about where that meal is coming from. 1 out of every 8 households across the country. So what exactly is food insecurity and what's the definition we go by? I'm going to kind of breeze through these pretty quickly, but I want to make sure that we're also grounded on the thought process that food insecurity is really all about the state of being without the reliable access to sufficient quality, quantity, and affordable nutritious food. So that's one way to put it. Many different definitions out there, but that's how we define it. There are also kind of 4 key pieces of that. With food security, if you are secure, if we flip that verbiage a little bit, you have reliable access to food, you have sufficient quantities, you have affordable food, and you have nutritious food. So all 4 of those categories need to be met. It doesn't necessarily mean that we all eat nutritiously the way that we should, but we have access to that, and that makes us food secure. When we think about food insecurity, though, there are different levels of it. So this is also something to just be cognizant of. We have people with very high food security, meaning that there's no problems in those 4 categories. We go to a marginal, a low, and even a very low category where all 4 of those things are affected. Your variety, your quality, and your quantity, your nutrition, all of those things would be affected. So is it really a problem in the United States? I mentioned 1 out of every 8 households. Yeah, it really is a problem. If you break it down to individual people, we're saying that across the country, 1 in every 10 individuals is suffering with food insecurity. Now, add COVID-19 into that picture, we don't have reliable data yet to really track what that has done to these numbers, but we're only guessing that that has really increased since the pandemic has broken out. But looking at the map across the country, it really is staggering to see some of those areas with the really dark green. That's where the higher food insecurity rates are. Personally, I'm from Arizona. I see that as sticking out like, wow, look at all the dark green there. A lot of our Indian reservations throughout the state are really suffering, and it just really varies across the country. But let me break this down a little bit more locally here in Illinois. 1 out of every 9 Illinois citizens is suffering with food insecurity. 63 or below that 165% of the federal poverty line. So pretty concerning. Here in McLean County directly, it's 1 out of every 8 people. So kind of surprising for some folks, but I also want you to remember we do have a high population of college students within McLean County with our colleges. That plays into it. A lot of times our college students can fall into this category of food insecure as well. But how is it affecting children? 1 out of every 6 children across the country is dealing with food insecurity. That's even higher than our adult rate. That's actually 12.5 million, more than 12.5 million kids. And if we take a look at the map for the children across the country, a lot of dark green being visible throughout a lot of our states. Those are the heaviest areas for children dealing with food insecurity. Here in Illinois, though, if we dig in a little bit deeper, over 400,000 of our kids fall into this category. That is 1 in every 6. And if I advance even further here, McLean County, we're talking about 1 out of every 7, so a little bit better than the state's average. But that means over 5,000 of our kids right here in McLean County are not sure where their next meal may be coming from. But why is this such a big problem in America? Obviously, food insecurity is an issue. We want to also talk a little bit about that link between poverty and food insecurity. I think a lot of times we just assume those two go hand in hand, and sometimes they do, sometimes they don't. But food insecurity and poverty can be considered two different terminologies. In 2017, with the most accurate data that we have is that 12.3% of the United States citizens were in poverty. Here in Illinois, that's 12.5%, but McLean County, 15.6%. But it all goes to prove that there's this affordability component to food insecurity. Poverty and food insecurity really do correlate. One other factor to think about here, just in our state, is food deserts and food insecurity with reliable access. If you can see on that map, I know it's pretty spotted, but all those purple or pink areas, that's where people are considered to be in food desert areas, which means they don't have a convenience store, they don't have a restaurant, they don't have a grocery store within a 1 mile radius if they're in an urban territory, or within a 10-mile radius if they're in a more rural area. We have a lot of food desert population throughout Illinois. Food insecurity, food nutrition, obviously, we're probably all well aware that when you choose quantity over quality, your quality suffers, your nutrition suffers. I know a pack of ramen noodles is a heck of a lot cheaper than a fresh cut salad or the ingredients to put into something homemade. So we definitely suffer in terms of the quantity and the quality, but it really is a vicious cycle. Low income and poverty, it causes stress, it causes poor eating habits, which then leads to the development of chronic diseases and other conditions, which then leads to failing health, which then leads to medical costs, which then continues to keep Americans in poverty. So these are all things that we are super concerned about, and we know that exist. Just some quick studies around hunger in America. We do know that when people are visiting food banks and food pantries, they were able to do some research to show that 58% of clients are suffering with high blood pressure, or somebody in their family was found to be in that circumstance, or diabetes. 33% of the families had diabetes represented. So those are some high indicators. We're concerned about things like heart disease, obesity, twice the risk for diabetes, and even mental health. They're all challenges in terms of food insecurity. Food insecurity also, we know, permanently impairs the development and the growth of children. So when children are put into the mix, we know that they are likely to be held back in school, or to fall behind their language development, their motor skills development, their IQ development. They're going to be twice as likely to have behavioral problems in the classroom, more increased for those chronic diseases, and more than twice as likely for depression and suicide. So what are we doing to fight food insecurity? Let me tell you a little bit more about Midwest Food Bank real briefly here. You might have heard that we started in 2003. The Keyser brothers started Midwest Food Bank on the family farm. This is a picture of the barn where it all began. They had read an article in the Pantograph that talked about 10 local food pantries that didn't have enough food on their shelves. They were struggling to make ends meet and struggling to find enough food to feed their clients. So the brothers got together and thought, you know, we're resourceful farmers, we can figure this out. They started making phone calls. They started making connections for extra wasted food, extras from manufacturers, and it started rolling in. Started rolling in by the truckloads full. They had to build a new barn on the family farm. Eventually they moved to the south end of Bloomington off of Veterans Parkway there behind Starbucks, and started the first official division of Midwest Food Bank. And here we are today, actually out in Normal. We've quadrupled our size. We have 11 locations and a new one soon to be coming in Hershey, Pennsylvania area later on this year. But we also serve some international locations in Kenya and in Haiti. So we're doing work all across the country and beyond. Our growth, I don't expect you to be able to read all the details here, but I just want to show you that bell curve. Over the years, these are the amount of dollars worth of food that are distributed each and every year. So 2019, we gave out almost $280 million worth of food, 100% free of charge to food pantries and agencies that serve clients in need. So Home Sweet Home is one of our pantries that we support right here in the community. Our model here at Midwest Food Bank, we take 3 things and turn them into 4 big programs. Financial donations, of course, food donations as well, and then volunteer efforts. Here at our Bloomington Normal location, we have about 10,000 unique individual volunteers each and every year. We could not do it without them. I have 4 people on staff, 10,000 volunteers, and it's a very big process, and we couldn't do it without everybody being involved. But we turn that into helping support our food pantries. Here in Bloomington Normal, we serve over 490 food pantries out of this location, 2,000 or so throughout the country and worldwide total. We do disaster relief, where we send out family food boxes, cleanup kits, and other support to disaster situations. We build our Tender Mercies meals as well. It's a rice and bean protein pack, full food that you can make in a pot of water and boil and have an instant nutritious meal. And then our Hope Packs program, which is providing food for food insecure children on the weekends when they're outside of school. So our feeding programs, nearly 20% of the food that we distribute is produce and it's protein. I know a lot of times people will come to our warehouse and take a tour and they're like, wow, I see a lot of junk food on the shelves. We do that too. Unfortunately, junk food is very prevalent in our society, but what we found is that if we don't take all of the food that is offered to us from manufacturers, they're not going to send us the good stuff too. So we have plenty of produce and high protein foods on hand, but we'll also take everything else that they are wasting so that we can still distribute that out to the community and let no food go to waste. I mentioned disaster relief. We've been actively involved in disaster relief, and right now we're kind of considering this pandemic timeframe a disaster. So we've been doing family food boxes with our partnership with the Salvation Army. Family food boxes will put in enough food to feed a family of 4 or 5 people for about 4 days. We've got volunteers actively packing these, and we've been doing it since the beginning of COVID-19. We're getting a little tired of doing family food boxes, but we've sent out over 60,000 of them already this year. We've got about 8,000 more on order. There's a light at the end of the tunnel. We're excited about that. But these are being distributed to families who are directly affected by COVID-19. Maybe they are quarantined themselves because of the illness. Maybe they can't get to a grocery store, or they're part of a vulnerable population that can't get out to go shopping. And we're able to work with the Salvation Army to get this food delivered directly to households in need. I mentioned Tender Mercies, our meal with rice and beans. We're actively making that. We have a great big machine at our location in Morton. It's really neat to see. It was originally created to mix cement, but it's a brand new machine that was donated to us that we were able to recalibrate to put all these parts and pieces together to make Tender Mercies. So 13 grams of protein per meal, and we can make an entire bag, which serves a family of 4 for 80 cents. And that's a little picture of the bag there on the screen. We've done over 6.8 million meals of Tender Mercies in 2019. Here's a group making our Tender Mercies, and there's that machine in our Morton facility. So we hand package it, we go on site to different companies and do it there as well, or packing it by machine in Morton. I mentioned Hope Packs, our backpack feeding program for kids in need, where we're feeding kids over the weekend. This last school year, right here in Bloomington Normal, we served 3,325 students every weekend for the entire school year. It cost us about $50 for one child for the entire school year because we're able to leverage donated foods. We do have to pay for fuel for our trucks to go collect that food, but volunteers process it, get it sorted, get it ready to distribute to the children. So every weekend, we know that they're getting some source of food before they return back to the free and reduced lunch program on Monday at their school. This upcoming school year may have some serious challenges depending on what individual school districts decide to do, but we're up for the challenge and want to make sure that the kids that have been a part of the program continue to be part of the program. So Illinois Prairie Community Foundation has been very helpful in sponsoring children and helping us with the backpack program each year. So we're very thrilled for that relationship and very grateful. I'll forward here real quick to volunteers. I mentioned 10,000 volunteers a year right here in Bloomington Normal. Overall, throughout our entire organization, it's over 32,000 volunteers. That's about 1 staff member per every 800 volunteers, if you think about it that way. The amount of time and manpower and effort and talent that our volunteers put into it is absolutely immeasurable. We can't do it without our volunteer support. And a few last points here. You may have heard about Charity Navigator before. We're very blessed to be able to be considered a 4-star charity with Charity Navigator. They rank independently different nonprofits throughout the world on their financial responsibility, and we're very blessed to be a part of that team. So how can you help? Praying for the mission of Midwest Food Bank first and foremost. We covet your prayers that we can help all of those who are needing to be served and do it well. Time, talent, money, all of those things also go into the mix with helping here at Midwest Food Bank. And I want to kind of end on one of these big points. It's absolutely remarkable to me that we can take each $1 that's donated and turn it into $30 or more of food. And that's by, again, leveraging our volunteer support, leveraging our own trucks, just having to pay for fuel and not always paying for brokering, those types of situations. We're able to really maximize on each and every dollar to make sure that people throughout our communities are fed. Being a share partner is another opportunity, monthly giving. Obviously, if you know anybody that's looking for a nonprofit to support, we covet the help of our share partners that are able to do that on a monthly basis. So thank you so much for letting me be able to present today. I hope that that made a lot of sense, and I kind of put it into new light for our community and what we're looking at with food insecurity and how we can all help.
Thank you, Tara. I knew some of that, but not all of it. It's very impressive and distressing as well. So we're going to open it up for discussion and questions. Again, if you want to type in the chat box, but if you don't want to type in the chat box, just raise your hand and unmute yourself and ask a question of Marianne or Tara. Marianne, I did have a question. I saw that early on when COVID began, and I don't know that it's COVID related, but the you had a change about your the store that you used to run or are running. What's the situation with donations of items and what you're doing with that?
Okay. Well, it did coincide with the pandemic. We had operated a store we called the Mission Mart, a thrift store, since 1988 here locally. Actually, sales had been declining over the last several years, like many retail businesses. We know that many retail businesses have gone out of business. And so we were close to that point. We were also facing Illinois' minimum wage increase law that was going to have a significant impact on us. And we needed to close the store at least temporarily because of COVID-19. And so we looked at all of those factors and did make the decision to close the store, which was a disappointment for a lot of people, including the people who like to shop there, the people who like to donate there, and certainly our employees for sure. Some of our employees, or all of our employees, had an opportunity to express interest in other positions at Home Sweet Home. So we were happy that we were able to provide that for those individuals who chose that. But back to your question about the donations. So in addition to people dropping off donated items at our Mission Mart, we also have and continue to have 19 locations around Bloomington Normal. They're big white bins. They say HSH Renew on them. You can go to our website and find the location for all of those bins. And people are welcome to continue to donate clothing and shoes. We are able to sell clothing and shoes that are donated to a salvage company. And then that company distributes those goods in a lot of different ways. Some of them will end up in a thrift store somewhere. Some will go to third world countries for their markets. Some will actually be shredded and show up in your currency or your roofing materials or who knows what. But we're trying to continue to do our part to keep items out of landfills. That's not a good place for them. So that's kind of what's happening. We are, so the Mission Mart is totally permanently closed. We are in the process of retooling that building. We plan to move our Bread for Life Food Co-op, which has been in our basement of our shelter, up into daylight to put it in the Mission Mart, and also are looking at using part of that building as a bit of a community center for people to come and gather. So we will be sharing information about kind of the new plans for that building. We continue also to have our warehouse on West Washington Street, and are in the process of looking at other uses for that building as well.
So I do see there's a question in the chat box for Tara. How does Midwest Food Bank utilize volunteers during the pandemic?
Great question. Thanks for asking. We have been utilizing volunteers all the way along. I have to say that normally we have a core group of volunteers, a lot of retirees especially, that are coming in on a regular basis. During COVID, we've lost a lot of those folks just for out of respect of their own health and wanting to be cautious, and that's completely understandable. But we've been using volunteers in the community right now to pack those family food boxes that we're sending out with the Salvation Army. We have signups through our Facebook, or we can find that link on our website. To come in small groups. So we are right now up to groups of 15 to 20 people. We were doing groups of 10 only before, with social distancing, masks being used, gloves being used, sanitizing at the door, and also taking temperatures to keep everybody as safe as possible within the building. So we still need help processing food, doing those family food boxes, those sorts of tasks. The food still has to get out, so we still need that help. The other big thing is still doing distributions. The agencies that we serve have been requesting anywhere from 20% to 50% more food on average than what they normally do because of COVID. So getting the food out the door is really big. When our food pantries come to visit us to pick up their food, it takes volunteers to load the carts, to load their vehicles, to get everything out the door. So we've been doing that in smaller than normal groups. Right now we're up to 50 for distributions. We were trying to do it with 10 and it was an absolute nightmare, but thank goodness that has opened up a little bit since then. Normally we'd have about 100 people are here at one time for a distribution. We're up to 50, but we still need that help for volunteer sake.
Okay. Sally, did you want to ask a question? Sally Rudolph.
I was just I was in the middle. I was just curious to know what Tara's responsibilities are as far as the international factor here.
Yeah, great question. Thanks for asking. We, like I said, have the 2 locations in Haiti and in East Africa. We have individual teams that do manage those locations as well. There's nobody physically living in Haiti, but we have a board here that takes care of sending loads to Haiti. Actually, all of that food comes right here from the Bloomington Normal location, which boggles my mind sometimes. It's kind of crazy to think, but we ship it to Florida and it gets on a sea container. It goes by boat to Haiti, and we've got volunteers there that help to distribute it. We also have a board and 2 employees in East Africa. The board is here in the United States, but they help with the distribution of food there. We're not actually shipping food to East Africa. That would be way too expensive. They are sourcing local foods, and they're building their own version of Tender Mercies right there to be able to distribute. They do a lot of work in both countries, both areas, with Tender Mercies, with feeding kids, especially in the school programs. It's a great opportunity to ensure that kids are getting an education, but also getting fed and getting the proper nutrition. So a lot of work with Tender Mercies. And it's actually really interesting in East Africa, their Tender Mercies blend is different than ours, because we're sourcing local ingredients. They don't grow pinto beans there. We have pinto beans in our mix here. They grow cowpeas. And so cowpeas are high in protein. That's put into the mix there. Tastes a little bit different, a little bit more edible for the local palate, the cultural palate. So a lot of work being done with Tender Mercies and other local produce.
Thank you.
Other questions? I have another one for Mary Ann.
Okay.
So with the folks who are in your shelter right now, I assume that families are together in one room, everybody else has an individual room, but what do you have to do to stay sanitized and keep folks healthy who are living there now, as well as your staff?
Well, we sanitize. Yes, you're right. The families, each family does have its own room. Now, other individuals do not. They are in shared rooms, but we try to keep them socially distant. We also, during meal times, if any of you, I know some of you have been in our facility and you've seen our dining room. So typically, in our dining room, we'd have like an 8-foot round table and we'd have maybe 6 to 8 people around it. Well, now we have 2 people at each table at the most. If it's a small table, it's only 1 person. Everybody is required, everybody who enters the building, staff, volunteers, clients, are all required to wear masks or face coverings. We take temperatures once a day for everybody who's in the building. So those are some of the, we also, our employees are tested every 2 weeks. We get COVID testing every 2 weeks for all of our employees to try to ensure that we're all negative. So far we are. We've looked into testing for our clients, but it's a little bit difficult because, as you know, the testing has been, well, actually, to kind of go back, at the beginning of the pandemic, we couldn't even get our employees tested. It was really difficult. I mean, you know, there was this criteria for who could be tested and who couldn't. That's opened up a lot since then. Also, initially, when we were able to be tested, it was a drive-through, and you had to have a car to drive through, and many of our clients don't have cars. Now that's opened up, so you can, you know, you can take a bus out there and get it, but it's not terribly convenient. So we've been working with the health department. The health department has been fantastic in terms of just helping provide us with guidance in terms of, you know, how to manage all of this. So we've worked with the health department about the possibility of getting some testing, you know, come to us, you know, so that our clients can access it. We're not quite there yet, but we're still working on it. So that's a little bit about what we're doing. And that's why, I mean, that's why we suspended volunteer activities. Now we have, I don't know if I said this or not, but we have initiated having volunteers come back. So, but before they come back, they all go through training to, you know, learn all the safety requirements. You know, they certainly have to agree to wear face coverings and all of that good stuff too, have their temperatures taken too. So no one's exempt from that.
How's this affecting your donations and your income? I mean, are you receiving some people I've read, you know, are giving more during this time of COVID. Certainly those of us who are feeling like we can't do anything, so we just give money because we can't help. We're stuck at home. We're not spending as much on other things, so might as well use your money for a good purpose. But I know that many organizations are really facing, you know, serious crises as far as their operations. So how is that affecting you, Marianne?
Actually, our donors have been very, very generous and very faithful, and they've done, many of them have done exactly what you've said. In fact, we've had many donors who have said, well, I got this stimulus check and I don't need it, so here you go. You know, and we are happy to take it. Every year we have what we call our May Community Challenge. And this year our goal was like to raise $120,000 through that. And our community raised $160,000. Just totally blew us away. So, and I don't want to, I mean, we still need money. We still need money, but people have been generous and faithful. Another thing that we rely on, okay, so a number of agencies, you know, have a variety of different sources of revenue, and we don't have very many. It's mostly donors. And, you know, without the mission mark now too, then, you know, we don't have that source of revenue either. But the other thing that we rely heavily on are donations of food. So we get a lot of food from the Midwest Food Bank, but we need, you know, we get food from a lot of other sources as well. And during the pandemic, we did need to limit any, you know, people used to bring us their homemade cookies. Well, don't bring us your homemade cookies anymore. So we required that things be, you know, individually packaged, you know, bought from a store or from a commercial kitchen, that type of thing. So, but that's gone well. It has gone well. And that kind of reminds me in terms of just our dining services. You know, we used to have this lovely salad bar. Well, we put the salad bar away. You know, it used to be a lot of, you know, kind of help yourself to this or that. And so everything is put in individual serving portions and then provided to the individuals who were eating. So we had to change a lot of things there too.
And Tara, the question for you, you know, we've read about the fact that early on farmers were having to euthanize animals and that we can expect shortages in certain areas. How's that affecting Midwest Food Bank?
Yeah, what a crazy wild ride this year has been, especially from a food supply chain perspective. We went through the initial phase where all of the shoppers were hoarding, and so the grocery stores were emptied very quickly, couldn't keep up. Production companies had to slow down because they're concerned about COVID within their own factories. The meat supply has been a huge concern with the amount of COVID cases amongst the meat butchering facilities. So a lot of concerns, and it has been a tough ride, I'm going to be honest, over the past few months trying to locate food, trying to find enough food for the increased need, not even just our basic needs, has really been a challenge. Luckily, things are starting to level out a bit. We did run a campaign, and it kind of to your question on the funding piece earlier, for helping to save the pork. We noticed that a lot of our local hog farmers were really suffering. There weren't enough appointment slots available to slaughter the pigs because the larger factories were shut down with so many of the COVID cases. And so they were turning to local processors to process. Local processors are overwhelmed. Local farmers oftentimes weren't getting paid for the hogs. And we had a very generous outpouring from the community to raise money to literally pay for hogs and processing. So we're still doing that with the money that came in there, which was a tremendous blessing. But we've also lost our ability to hold several of our fundraisers this year. With a big gala that was scheduled in April, we postponed to August. We had sold 350 tickets, so we knew people wanted to come, which was great. We maxed out our capacity, but in August, we're still not at the point to be able to have that many people in one facility at one time. So we're shifting that to an online auction. Marianne said it best, the stimulus checks were a great blessing. We did have some donors that signed that completely over to us because they just didn't feel that that was something that they and their household needed at this time, and they were able to bless others. But got a lot of questions up in the air for the end of the year. I'm gonna be honest, that's something that kind of keeps me up at night. Some of our donors during COVID timeframe are typically our end of the year givers, right before tax season is closed out for the year. So we don't know if they're going to give again. We don't know with the increased need that we've had if we'll see additional gifts this year or if they just bumped that up earlier in the year to help during the pandemic. It's a blessing to have that now, but we also missed out on the gala. The golf outing had to be canceled. The bike ride had to be canceled. So a lot of things shifting this year, and the food supply chain has not added much help into that mix.
I don't want to monopolize all the questions. So others, do you have questions or comments?
I wanted to ask Mary Ann, how many people are staying there now, and how long can they stay at the mission?
We probably only have about 20 or 25 people there. We have a capacity for 70. So really, when I said, we haven't been inundated with people, I'm serious, we really haven't. They can stay as long as they need to. That's what we say, and not a day longer. So we do not have a limit in terms of how long they can stay. An average length of stay is about 3 to 4 months. I will tell you about one of our recent residents who just left this week. He just makes our heart proud. We have a special program for veterans. We work with the Veterans Administration. We receive some reimbursement from the Veterans Administration when we provide shelter for veterans. This gentleman had been with us for over a year. It was just the most delightful person you'll ever want to meet. Always had a smile, always had a kind word for everyone. But it wasn't easy finding a place for him to live. And a lot of people came together and worked together, and he now has an apartment of his own, and we're so thrilled for him. But anyway, so we continue to have people move in and move out, throughout this time. And like I said, I don't know, what it's going to look like a few months from now if the moratorium on evictions does not get extended. I don't know what's going to happen. I don't know what landlords are going to do. I mean, if landlords are going to want all their back rent, which I would think they would, people aren't going to, if they haven't been able to pay it during the pandemic, they're not going to be able to pay it 2 or 3 months from now either. So I'm not sure what to expect. Luckily, since our census has been down, we've been able to do social distancing. I mean, we really could not accommodate, if we had 70 people, 70 residents in our shelter right now, well, I mean, we'd have to start lunchtime at like 10 o'clock in the morning and go till 2 o'clock in the afternoon, to stage people so that, there was plenty of distance between them as they, were having their meals. So it's actually been a bit of a blessing.
Any other questions or comments? Yeah, I mean, the moratorium may end, the stimulus checks may end. My personal thought is when the college students, if they return, there may be an uptick in COVID cases, looking at other places. When the weather gets cold, I'm sure there are people who are surviving outside, even during this oppressive heat. So those things could be all pretty impactful. Sorry to be a downer, but it's one of those years. Okay, well, if there are no other questions, Tara and Mary Ann, thank you very much. Learned a lot. Yes.
Thank
You're
you.
welcome, both of you, and thank you for the work that you do. It's so important. And I think all of us have been inspired by what you do. And those of us who can, I think we'll go get our checkbooks or our credit cards out for sure. As I mentioned, the steering committee meets next week. We learn how generous our members have been. If you haven't made your contribution for the year, please do so that we can add that to the mix. And then we'll focus on what kinds of organizations and what our focus will be. In the last year or so, it's been women and children and those organizations who provide services that are trauma-informed. There certainly continues to be a lot of trauma to all of our folks in the community in need of services. And we will, we hope to at some point later in the year share with you how our current group of grantees have been using the funds that they received. I think I might have said earlier, we didn't want to impose upon them, burden them by another, presentation of how they're using the funds. Frankly, the funds sometimes aren't being used for the initial purpose, but we've been pretty flexible with that because we know organizations definitely need the funding, but some of the programs they initially thought they were for have not been able to go forward. But supporting our organizations is certainly something that we want to do. So, and we may have a fall forum. It may be online again. Zoom is, frankly, starting to like it, although I miss seeing and being with people. It's also pretty nice to sit here with my bare feet. Nobody sees, but it's a way to inform yourself, and to at least it's good to see all the faces for those of you willing to share your faces. And thank you for sharing your time today. We've recorded this, so if you would like to go back and review, or if you have a friend who for some reason wasn't able to join us this morning, but you would like to have them know what we learned today, please tell them that they can access this. Michelle, can you tell us how?
Well, hopefully later today I'll get this posted, and I will send an email to everybody who signed up for this class. But I will also be posting it on the Illinois Prairie Community Foundation's website. They'll probably need to do a search in the search box. It's once this event is over, it kind of disappears, but you can do a search for food and housing insecurity or something like that. You'll find the event. It will have the link in there also.
Okay, great. Thanks, everybody.